Welcome to today's event. We will now begin.
Good afternoon and welcome. I'm Sherry Gleed, Dean of NYU's Robert F. Wagner Graduate School of Public Service. I'm sitting in my office, sitting on an orange chair with a white wall behind me, wearing a black jumper and a gray top and a green necklace. NYU Wagner has partnered with the Century Foundation for several years to present timely and informative public discussions of policy topics that are front and center. Few could be more so than the implications of last week's elections on health policy in 2025 and beyond. With the election behind us, what are the opportunities and the challenges for healthcare policy under a Trump presidency? Today, we'll unpack the various impacts of the election on the Affordable Care Act, reproductive health, drug pricing, and more. I understand that we have some individuals with sight challenges joining us today, so to help set the stage for them, I would like to ask all of our speakers to please describe yourself and your setting before you speak. Before we get started, a few housekeeping notes. Please note that this event is being recorded and live streamed. If you'd like to submit a question for our panelists, please do so using the chat feature. With that, I will turn this over to Mark Zuckerman, president of the Century Foundation and my longtime colleague. Mark.
Thank you so much, Dean Gleed, and thanks to our panelists and those of you joining us on YouTube. For those of you who aren't familiar with the Century Foundation, we are an independent, progressive think tank pursuing economic, gender, racial, and disability equity in healthcare, education, and the economy. We know, and you know, that health policy is a major issue for any president, no matter what. 1 out of 10 jobs are in healthcare. Its spending consumes 17% of our economy, and we all need and seek quality healthcare at some point in our lifetimes. The results of last week's election have major implications for U.S. health policy, and as such, we've pulled together a distinguished panel of experts to explain that here. We've also fielded a post-election survey with our partner Morning Consult on voters' perspectives on health policy, and we'll share those results in the coming hour. With that, I want to welcome our incredible moderator, Jonathan Cohn. He is a senior national correspondent at HuffPost and the author of seminal books on health reform to moderate the session. With that, I'll turn it over to Jonathan.
Thank you, Mark. Thank you, Sherry. I'm sitting here in Ann Arbor, Michigan, in front of a blue wall with some prints on the back and a blue sweater. Please do not read any political affiliation in that. It just so happens that my office is blue and my blue sweater was clean today. I would like to welcome our very distinguished panelist, Fatima Goss-Graves, President and CEO of the National Women's Law Center, Mark McClellan, Director, and Robert J. Margolis, MD, Professor of Business, Medicine, and Policy at the Duke Margolis Institute of Health Policy at Duke University, and Jean Lambrou, Director of Healthcare Reform and Senior Fellow at the Century Foundation. Their full biographies are on our website. What I can tell you is that all of them have a great deal of experience in healthcare policy, and that by definition, because they work in healthcare policy, dealing with the politics of healthcare policy, which is what we are here together to talk about today. The impact of this election on healthcare policy, where we might go in a Trump presidency. And just as a starting point, Mark Zuckerberg, that is, mentioned at the top that there was a poll commissioned after the election from Morning Consult with a number of questions about healthcare. And I want to read you one of the initial results, which was an open-ended question, which was thinking about your choice for president in this election. To what extent did healthcare policy matter when you voted? And the answer was 45% said it mattered a lot. Another 28% said it mattered somewhat. So you do the math, that's 63% of the public who said healthcare was either, for whom healthcare mattered somewhat or a lot. It did not always feel like a healthcare election, and for the most part was not a healthcare election. But this election is going to affect healthcare, and lots of people care about it. And so I would be curious, I want to start by asking each of our panelists briefly, just to talk about what message they took away from the election. And I'm going to try to mix up the order as I go. So Jean, I'm going to actually start with you on this question. The election, the results, you read it. What message on healthcare did you take from the election?
Well, thank you, Jonathan. And I am Jean Lambrew. I am here in a white room with a colorful scarf, and I'm really grateful to be here today. I don't think you could look at President-elect Trump's positions during the campaign to accurately predict what he'll likely do on health policy because he disavowed proposals like Project 2025. Before the Republican National Convention, he pushed back on some of the party platform's positions and said only he speaks for his agenda. And even during the debates, he said he had concepts of plans, but did not detail those plans. That said, I think it's safe to say with his record, a Republican Senate, maybe a Republican House, I think we'll see for the health sector more deregulation for private health insurance and private providers, more deference and delegation to states in Medicaid in the marketplace, and given his focus on other priorities like the economy, likely less financial support for our healthcare coverage programs, which could likely mean an increase in the number of uninsured.
Fatima, what was your read on the election? What message relative to healthcare did you take from the results?
Well, I want to pick up really where Jean left off because I actually think the biggest healthcare issue in the election was access to abortion care. And you saw that both directly where voters were able to participate in that, and abortion overwhelmingly won in those examples. 7 ballot initiatives passed. 1 more did not pass, but the vast majority of the people in the state of Florida would have wanted it to pass. At 57%, that was not enough. But at the same time, in those same states, in many of those same states, voters voted for President Trump. And so I actually think what is interesting about the story of abortion winning, I think you could say both Trump won the election and abortion won the election. And so whether there is a mandate for any specific abortion policy at the federal level, I think many of us would say there is not, in part because of the late stage disavowing and commitments to not ban abortion that came from the campaign.
Mark, what message did you take?
Well, first, Jonathan, it's great to be here with you and the Century Fund and the rest of this distinguished panel. And I'm traveling today and in a gray room. And just like, don't read anything into Jonathan's blue. Just because it's gray in the background doesn't mean I don't have much to say. So it's great to be with you. And in terms of election, just maybe a couple of complimentary points. I know this is being viewed as a big shift election. And it is. It does have a lot of consequences. But if you look at the big picture on voting, we're talking about a several percentage point or so shift in how the electorate voted at the presidential level. And there's a lot of ticket splitting going on in Congress, too, and at the state level. And which seems big, but that's because we continue to be in a pretty closely divided electorate. If you think about the 2020 election, that one was also regarded on the one hand as a big shift of support to Biden and the Democrats. It led to 2 major pieces of legislation, the American Recovery Act and the Inflation Reduction Act, both of which were passed under so-called reconciliation approaches with 0 Republican votes, and both of which had major consequences for health and other policy areas. We're kind of teed up to see that happen again this time around with the Senate and the presidency and probably the House going all to Republicans, but the Senate and the House by narrow margins kind of reminds a bit of what was happening 4 years ago. So there's a lot of talk about realignment and things like that. I don't think that's all settled yet, but there will be consequences for healthcare. to just add one more dimension to that, there were some important dimensions of healthcare reform where there were kind of similar directional steps under both the previous Trump administration, also a fairly close victory, kind of like this one, and the current and the previous Biden administration. So in areas like Medicare and Medicaid moving into this kind of public-private collaboration with many more people getting their coverage either through private health plans overseen by the government or through so-called direct contracting or paying healthcare providers based on outcomes and person level services rather than traditional medical services. That's led to more shifts to digitally based healthcare, to home-based healthcare, to addressing the non-medical factors that influence health outcomes. And those trends have continued through both of the previous administrations, and I think are likely to pick up again too. So some things unquestionably changing and some real questions right now about how all that's going to go. But I think some trends that are likely to continue through as well.
Well, that was, this is Jonathan again. That was a lot of interesting threads. You may have seen me pull out my piece of paper because I jotted a few down that I want to come back to later. I want to pick up on the point that you made about Congress, and I think that's an important kind of framing device for where we go from here, which is it is likely we're going to get another trifecta. It's not definite yet, but the Senate will be in Republican control. President Trump has won the presidency, and it does look like the Republicans will probably control the House. With that in the back of our minds, I want to go to each of you and ask you to think about a policy area that I know you specialize in. And Fatima, I'm going to actually start with you, and I want to talk about women's health and abortion rights. And just to frame that discussion, to go back to the Morning Consult poll that was commissioned, I'm going to read you two results just to kind of set us up. One of the questions they asked was about this possibility of a national abortion ban. And they said, would you, the way the question was phrased was, would you support waiving the filibuster in order to pass a national abortion ban, basically being able to do a national abortion ban with just 50 votes in the Senate, which, given the makeup of the Senate, would be necessary. 25% of respondents said they either strongly or somewhat would support that. 47% said they would strongly or somewhat oppose, and then you had another 29% who said they did not know. Another question was actually about in vitro fertilization and asked, given that Donald Trump is the next president, how much priority, if at all, should he make of expanding coverage of in vitro fertilization and other fertility treatments? 59% said it should be a top priority or an important priority. 30% said not too important a priority or not a priority at all. And I think it's interesting to put those two side by side because I think it gets at one of the issues here, which is something you were talking about in your opening comments, which is not just the way the voters acted, but the way the rhetoric coming from the Republican side, which now has control of government, was a bit all over the place. I mean, we had references in Project 2025 to various kinds of restrictions and national bans, and certainly we heard from Republicans who supported that. We also had President Trump distancing himself from a lot of that. We had him calling himself the father of IVF, I remember very well. And I will tell you, sitting here in Michigan, where we recently passed 2 years ago a state constitutional amendment protecting abortion rights, it was pretty much the party line for Republicans to say, we are going to respect what the people of Michigan said. So given that backdrop, where do you think we're going with this? What are we likely to see happen? Or what's the range of possibilities we might see?
Well, I realized I forgot to describe myself, so I will just say I'm wearing a blue dress and I have a red necklace and a lot of books on the shelf behind me. But I think the public is actually really confused around what it is Donald Trump would do. And until they are faced with that precise moment, they're not likely to believe it. It's also the same public that believed very deeply that Roe would never be overturned, despite all of the evidence to the contrary, a Supreme Court argument where the majority of justices were saying we should overturn Roe. It wasn't until people were faced with the reality that they believed it. And so I am curious about this sort of polling. I think the majority of people don't think a national abortion ban is possible, in part because folks have also been maintaining a line around let's leave it up to the states. But if you look to Project 2025, inside of it, you find not only ways for Congress, suggestion that Congress would pass an abortion ban, but Congress doesn't actually have to act for that to be a reality, right? The Department of Justice could revive a law from the late 1800s called the Comstock Act and use its enforcement power to effectively have an abortion ban in this country. They could also take steps to take mifepristone off the market, which is medication abortion and used in the majority of abortion care in this country. And they can also take steps to both change the litigating positions that the Department of Justice has right now, and also change their guidance on whether emergency abortion care is required to be provided as a part of the long-standing law EMTALA that requires emergent care for life and health-saving care. So there are a number of issues that are on the table that just go to abortion, that don't go to other types of reproductive health care, where the rhetoric was high enough level, or people just don't allow their minds to wrap around them, around the issue that's at stake. And we know from Project 2025, we know from things that Donald Trump and JD Vance have said in the past, that these are very much live possibilities with or without the trifecta in Congress.
Mark, you raised a bunch of interesting topics, including one very close to my heart that I am determined to get to before we're done, which is home care. But for the moment, I want to focus on prescription drugs, which is which did come up, mostly Democrats bringing it up, but came up in this campaign. And obviously in the wake of the changes that were enacted during the Biden administration as part of the Inflation Reduction Act, cap on insulin prices, giving the federal government some power to negotiate the prices of some drugs in Medicare. This was also part of the morning consult polling. I'll give you two top lines real quick. They asked, again, the same format, in terms of priorities for Donald Trump. Do you think that extending the $35 a month cap on insulin prices in Medicare to all insulin, including outside of Medicare, should that be a priority? Very strong response. 79% said yes, a top priority, or at least an important priority. Only 15% said not too important a priority, not a priority at all. Same question, but this time, should Donald Trump make a priority of increasing the number of drugs that the government can now negotiate? As you know, as maybe much of our audience knows, it's a very small, limited set of drugs, although it's set to grow over time. There were also proposals out there to extend that beyond Medicare. The polling result, again, overwhelmingly in favor. 75% wanted it to be a top priority or an important priority. 17% wanted it to be not too important a priority, not a priority at all. I imagine this is not news to you. Anyone who's followed this issue knows that the polling on this issue, when you ask it that way, in a sort of simple, straightforward way, it's overwhelmingly, the Democrats have known forever this is one of their best issues. Politically, as a policy debate, I think this is always interesting when we get to the Trump presidency, because it doesn't shake out like it used to. There's the traditional conservatives oppose government regulation of prices. They worry it will lead to inefficiency, it will stifle innovation. Liberals tend to favor it. And the Democratic-Republican divide, with some exceptions, moves in that way. Donald Trump, from day one, always talked about, doing something on drug prices in a way that rhetorically sounded very different. My theory on this was always that it fit two of his own sort of, ways of thinking, which, was negotiation, right? That was always how it's presented as drug, he's a negotiator. He gets the best deal. And of course, there's one constant in Donald Trump is that he hates the idea of other countries getting the better of the United States. And we saw action, I know, during his administration, although when it was time, when legislation came up, he did not support that legislation. And a lot of his executive actions didn't really go anywhere for reasons we can discuss.
Yeah.
But now he's in the presidency. He's got a chance to roll this back. I'm sure there are members of his party who want to roll it back. Where do you see, but he may not want to. Where do you think this might go?
Jonathan, it's a great question. And also it was I think your question had a good half of the answer in it. So I'm going to try and build on that. This is Mark speaking again. I think the short answer is that drug pricing and affordability of healthcare more generally, with drugs as the leading edge of Americans' concerns about that issue, is still around. It's still a top priority for voters on both sides of this election. So it is going to be part of the policy debates and discussions going forward. I do think it's going to be different in the Trump 47 era than it was in the Trump 45. For one thing, as you mentioned, there is legislation in place now, especially affecting Medicare beneficiaries, that is now a foundation for further steps. That wasn't there before. Start out with an area where I think there is a fair amount of bipartisan agreement. I'll keep coming back to this occasionally. It's important in the first week after an election like this. And that's in the changes in Medicare Part D, the pharmacy drug benefit in Medicare that made it more generous. Now, I was at Medicare when we started Medicare Part D, and it was a different era in a couple of ways. One is this is a drug plan provided by different competing private insurance companies, essentially. And we didn't know how well that would work. Well, now today, most people in Medicare are in one of these private plans that has drug coverage integrated and, clearly is an integral part of Medicare today. Second thing is that we didn't have the same kinds of drugs available then as we do now. Today, many more kind of advanced biologics that can treat cancer, obesity, you name it. And it's been it's a really amazing era of drug development and potentially really impactful treatments getting to market. But these are expensive drugs, often for more specialized populations. Back 20 years ago when the program started, that was much more the exception than the norm. So this Part D modernization, which was built off of a bipartisan set of legislative proposals, gives Medicare beneficiaries an out-of-pocket limit on their coverage, puts the drug plans at much more financial risk than they were before, with the goal of getting them to try to negotiate lower prices. And people are going to see those effects starting in January. You can see it now. If you're a Medicare beneficiary, you really should be looking at your drug benefit options because they're different this year than they were before. And there's some implications for the premiums and things like that too, but it is much more generous drug coverage. That I think is going to continue and will be something that people on Medicare notice in 2025 and beyond, even before the price negotiation. So for the price negotiation, as you mentioned, that's for Medicare only right at this point. That's what the IRA legislation included. And unlike other provisions of the IRA, including those related to climate, for example, the Trump campaign did not say anything negative, anything about repealing those provisions. The thing is, the way the law is set up, the administration has a lot of discretion in how they implement price negotiations. So, the usual process in government is you issue, what's called a proposed rule, you get a bunch of public comments on it, and then you finalize it. It's a lot of detail about exactly how the government's going to do whatever it's going to do. For this law, the Congress, the supporters of the law said, limited judicial review, lots of discretion to determine what the price is, the negotiated price on the government's behalf should be. And there is some guidance from the Biden administration. They just finished implementing the first year of this. It takes effect in 2026. But I think a lot of questions about how that program will be implemented. To your point about, President Trump does think of himself as a pretty effective negotiator. That program could see some revisions. So stay tuned and we'll see how that goes. That program is going to expand gradually. When President Trump was in office before, he did propose a number of rules, none of which really got implemented, to do things like set the price for drugs in Medicare physician offices based on prices in other countries. To your point earlier, that didn't get implemented. He said he isn't going to do that again, but he did say he does want to get better drug prices. So there's a different infrastructure to build on. And I think the administration this time will build on its experience last time around. Two more points on this. We could go on forever, but it's going to get addressed. There is going to get a lot of attention. It's just not completely clear how yet. But two other things I'd like to mention. One is the administration is much more focused this time around, starting on day one, to go after trade issues that it thinks is unfair. So a lot of that is focused on China, but it's not only about China. And with a more aggressive and robust tariff plan, tariff threats in place and the like, one can imagine using those threats against countries that where think the drug prices are too high to bring that into even as a trade issue. And then one more issue that's different that I know matters a lot for healthcare providers, for patients, populations with limited means, often without insurance or on Medicaid, and that's so-called 340B pricing. So these are extra discounts that hospitals connected with private clinic, with primary care clinics and outpatient departments get big discounts on their prices, like in Medicaid, for pretty much everybody they serve. That program has grown enormously in the last few years. It's an area where the Biden administration, the pharma industry have had conflicting proposals, some court battles, and I could see Congress potentially addressing that too as another way of not only making sure lower drug prices pass through to consumers, but also to address, which I think we'll get to, some of the legislation that is likely coming that otherwise would increase the deficit a lot.
That was a lot, and I can see already we're not going to get to everything, but there was a lot there, and I think speaks to how much is in play, things that people aren't even aware of. This is Jonathan. I'm now going to turn to Jean and talk about coverage issues. And just very quickly, there were a number of questions in the poll about coverage issues. I'm going to read them all to you at once for a reason. So there was a question: how high a priority to give to maintaining protections for pre-existing conditions, which was something that happened with the Affordable Care Act in terms of insurance companies, protecting Medicare, protecting Medicaid, preventing health insurance premiums from increasing because tax credits become reduced. They end up being reduced in value. I read them all together because the results were almost identical for all of them. For all of these, support was north of either this should be a high priority or a somewhat high priority, was north of 80%. There was a slightly higher number for pre-existing conditions in Medicare relative to Medicaid and the premium tax credits, but not a big difference, which I think speaks to the fact that these are also very popular positions. But again, we have an administration coming in that, as Jean knows better than anybody, very much identified with trying to, with the Affordable Care Act, trying to repeal the Affordable Care Act. There's always been a very important part of the conservative agenda to at least reduce spending on Medicaid, if not transform it into some kind of a block grant program. Some interest in the past, I don't know how much there still is, in some form pushing Medicare more towards a private system. And I'm curious what Jean thinks is going to happen given those interests. On the other, and the fact that given the interest in tax cuts, there may be interests in finding offsetting spending cuts to pay for those. But the Republicans went through an attempt to repeal the Affordable Care Act and make some big changes to Medicaid. It did not turn out well for them politically. So, Jean, where do you think we might actually be going in the next few years?
Well, and this is Jean again. I will say I think the sleeper story of 2025 will be whether congressional inaction results in cuts to the current level of premium tax credits for the health insurance marketplace. And just as a background, hearing Mark talk about being at the start of Part D and recognizing the need for modernization, I was at the start of the Affordable Care Act, which is 15 years ago, a long time ago. And there was a recognized need then and now for improvements, which the Inflation Reduction Act made by both increasing the value of and eligibility for the premium tax credits, and the evidence on its impact is pretty compelling. We've had record high insurance, record low uninsured rates in the last 2 years. We have seen the enrollment in the health insurance marketplace increase by 88%. We've now seen that there's 1 in 5 small business owners or entrepreneurs who are covered by the marketplace. This has disproportionately helped rural residents with an average premium tax increase of $890. And we also importantly saw the marketplace make a difference in coverage disparities. So we now have seen that there are more people of diversity who are the majority of marketplace enrollees than traditional white people. Now, it will be an interesting year because beginning in a few short months, insurance companies will begin to price out their plans for 2026 when this extension of these premium tax credit increases ends. By the summer, they'll make those hard choices. Are they in or out? And then less than a year from now, 20 million people in the health insurance marketplaces will get notices saying their premiums are going up by 50% or 100% with the expiration of these tax credits. And for those of you who remember the plan cancellation notices in the fall of 2013, that was a fraction of the number we'll be about to see. Now, as a policy matter, we think we know what's going to happen. Young and healthy people will drop out first. They're the most price sensitive. That will leave the older and sicker people in the insurance pool, which will further drive up costs. Health plans will begin to pull out of this marketplace, and we'll see potentially 4 million people become uninsured. This all can be prevented, though, because it will be a year of discussion about tax extenders. The big Trump 2017 tax bill ends. They're going to be debating whether to continue it. And I think there'll be a lot of policy as well as political pressure to include these tax credit improvements in that package.
I want to give each of you a chance to very quickly and raise your hand if you had something you wanted. First, let's do it this way. Raise your hand if you wanted to respond to something one of the other panelists said, and if not, I'll move ahead to something else. But does anyone have a quick follow-up?
This is Mark. Would just reinforce briefly Jean's point that the first big set of legislative issues will be the so-called reconciliation package, meaning you can pass it with 50 votes in the Senate, as long as it's got significant budgetary consequences, positive or negative. And high priority for the new administration is extending those so-called Trump tax cuts. Highest priority for extending something for Democrats, I think Jean is right. It's the ACA enhanced tax credits dating from 2021, 2022, and we'll see how that sorts out. This might be an area where there could be some bipartisan compromise, and if Jean's thinking about that, but maybe there's some steps towards more flexibility and how the exchanges work, and in maybe giving a bigger role to Anish Chopra, for example, was talking about recently. Could we make the exchanges more digitally enabled so it's easier for people to compare plans and providers, more transparency and things like that. But that is that's part of that number one set of issues, and should be will be high on the Democrats' priority list, along with the tax cuts for Republicans.
Just go back. I'm sorry, Fatima, go ahead.
Sure, no problem. It's Fatima. I also think we can I think that same opportunity where you have a must-do thing because the tax cuts expire, so there's an animating force, which makes it more likely to happen. I think there's also an opportunity for policy writers to be a part of that package, things that worsen both abortion access and contraception, things that upend how we think about the preventative care case that's at the Supreme Court already around who decides what services are a part of required preventative care coverage. And so I also think we should be, that we will be thinking about the range of pieces that are in there if it becomes the vehicle to do big healthcare policy with only a 50+ threshold in the Senate.
Dean, did you want to add something?
Yeah, Jonathan, you don't mind, because I did forget to talk about Medicaid. I want to come back to that, but just to build off of what Mark and Fatima said, let's just say there's going to be a big deal. If Republicans are truly in charge, they will try to do that. For women's health, we've seen this before. It might be, there may be a deal to try to say we will extend those premium tax credits, but there'll be riders that say no abortion coverage at all in marketplace plans. So I think there'll be trades in the policy space with budget space. Now, granted, again, reconciliation limits the extent that you could do that because they have to have financial implications. So that's one thing to watch out for. The other, though, is Medicaid. So President-elect Trump had said repeatedly he will not cut Medicare. So I think taking him at his word, there will not be significant Medicare savings in any sort of reconciliation package, which does leave Medicaid. We have seen for several years conservatives making the case that the program is too big, there's too much funding. We've seen different ways to try to chip at that. Some of them are process oriented. I think we'll see more work requirement policies out there, waivers or guidance, which basically are bureaucratic ways that people document that they're doing activities to get their health benefit, which evidence has shown will have people fall off the rules. We'll see more verification of eligibility to intentionally try to get people who are immigrants out of Medicaid, but it will really have the effect of creating barriers for all sorts of people who might otherwise be enrolled. I think we'll stop seeing approval of waivers that get at social determinants of health, like food or housing, maybe that get at medical debt as well. And those all will have a contractionary effect on Medicaid, but to get the scorable savings for a legislative vehicle, we may see some of those old proposals come back. Changing the federal state matching payment system, either explicitly by lowering the amount the federal government pays. We saw an idea this year that would lower it for what are called floor states, the wealthier states who get at least a 50% match. That could go away. We could see a return of per capita caps, capping the federal contribution on a per capita member. Those are the ways that you get to savings. But again, this has been something we've seen before. That set of policies will be extremely controversial given the vulnerable people covered in Medicaid, given the new number of people covered in Medicaid more than ever, and the state element, because there'll be a bunch of state governors and other actors that will push back.
Actually, Mark, you look like you wanted
Yeah,
to.
I was just gonna continue this. This is a big set of issues that will be coming up. This is Mark again, continuing this discussion that Jean was just talking about with Medicaid. So there will be a search for ways to save money to offset the cost of tax cuts, or if some Democratic votes are needed, or remember, there also are a number of vulnerable Republicans that are, the reason we don't know how the House has turned out yet is because there are a lot of close races where it looks like Republicans are ahead, but in California and other places, they just haven't finished counting yet. And these are in some of the limited number of still contestable districts, and these are going to determine the Congress this time around. They'll determine the Congress, the House in 2 years as well. So, some opportunity there, and there will be some discussion around that. While the president-elect was very clear that Medicare benefits are not going to be cut, there are some opportunities for savings in Medicare, ways to modernize how the private health plans are paid. We're still using, back to when I was there, it's been too long, Gene. We're still using the same way of determining how much a Medicare Advantage plan should be paid today, essentially as we did 20 years ago. And we've got so much better data now on patient risk and what it means for costs. Why are we still using these old, health insurance claims? So there's some ways to maybe save money, make the program work more efficiently there. A lot of good ideas around advancing more so-called person-first or person-focused care, where if you get your care in an outpatient setting or at home and it's less expensive, there's financial support for that. We don't just keep paying more to care that's delivered in the traditional way in a more expensive and less convenient setting. And then on the Medicaid side, those would be controversial. They have been before, they would be again. And I think there is an opportunity here, though, to really engage both sides of the aisle around what works in making healthcare better. And a couple of things I think could get maybe more recognition going forward in this round of the debate. One is that addressing non-medical drivers of health matter. So Gene talked about the social factors where there has been a lot of steps by the current administration to expand their incorporation in Medicaid plans. Well, I live in North Carolina, where we have a Medicaid waiver that has some direct payments for things like nutrition services or addressing insecurity in the household. And that was a waiver approved by the first Trump administration on the grounds that these steps accompanied moving to more accountability for health plans and healthcare providers to improve outcomes, reduce disparities, and get healthcare Medicaid costs down at the same time. That's why North Carolina expanded Medicaid with a veto-proof Republican legislature, because these are the cheapest ways to address health needs in communities. So I think there's an opportunity to move forward on this kind of discussion constructively. There needs to be linked to it some real accountability for, do these steps actually help reduce healthcare costs? Do they actually help improve outcomes? But I think, as I said earlier, we've seen a lot of movement over the last two administrations, Democratic and Republican, away from kind of traditional ways of paying for healthcare and towards this more person-first, person-focused approach with a lot of innovation in how community services, innovative private digital companies, things like that all get integrated into care. And that could impact the Medicaid debates going forward.
This is Jonathan again. Mark is making that with that answer made me think about the states and the role states play and setting their own policy direction. And Fatima, I was thinking about the various actions the federal government might take, and then what states might do specifically on abortion rights. Let's say you have a state that wants to protect abortion rights, a state that has. How much ability will they have to act for their residents to sort of carve out, or protect abortion rights or access to abortion in states if there is federal action?
Well, some of this depends, of course, what the federal action looks like, but we are seeing some states take preemptive protective measures to protect their providers that are in their state. People are traveling to their states. Some states are passing shield laws to ensure that other states aren't reaching out. I do think one of the areas that requires more investigation is whether or not people, especially as they were voting for state ballot measures, believe that that would be protective against a national abortion ban passed at the federal level, and misunderstood that federal state relationship, because there's been so much conversation about returning abortion to the states without the context of understanding preemption law and the idea that the federal government, when in conflict with state law, controls. The other thing that I have seen some states doing is state attorney generals have been banding together to ready themselves to challenge things that may be overreach coming from the federal government. And we've heard them speak collectively. There is also a governors association that has formed that is also planning to move collectively for those who are interested in fighting for reproductive freedom. So I suspect we will see more of those measures and real tension around this question. And then the last thing that I want to say is I said a bit about it, but I also want to just name that, you know, I've talked a lot about abortion, but contraception is also another area of concern, and one in which we are, again, if you follow Project 2025, can expect to see efforts to eliminate the level of coverage. We could see efforts to allow refusals to provide care, and certainly some rollbacks of steps that have been taking to make contraception more accessible, especially emergency contraception. And again, if those steps are taken, I could see an enforcement response from states, efforts to try to expand coverage in their own states, but I'm not sure what will happen in that tension. One thing in Project 2025 that is a proposal for states that are using their own Medicaid dollars to support abortion care, suggesting that would put them in violation of federal programs. And so we could see some squabbles between states like California that have extended and the federal government. And we for sure will see a revival of the efforts to defund both the work under Title X and to divert those resources to other areas that are not providing reproductive health care. And that is attention that is often framed as a Planned Parenthood fight, but it actually extends much more broadly.
We are getting close to the point where we're going to turn it over for some audience questions. One last topic, something Mark mentioned at the top, it's very close to my heart. Came up in the campaign as a proposal on the Democratic side. I don't think it was decisive in the election, but something where maybe there's some bipartisan interest, which is home care for the elderly and people with disabilities. Very quickly, like in a minute, Mark, let's start with you. Is there a possibility for some bipartisan action or maybe Republican action on this going forward?
Oh, it's Mark. I would frame this along with support for more advanced primary care and changes in payment that facilitate people getting the care they need, where they want it, and how they want it. So that fits in with some of the topics that I brought up earlier around Medicare and Medicaid reform through private health plans and through accountability for results. For those of you who are interested at Duke Margolis, we have a upcoming and had a recent event on care for homebound individuals about policies that can really help shift care to where people want it. It's tough to find new money to support, new fee-for-service payments or something like that. But there's so many opportunities to support home-based care workforce and helping people get care in less costly settings and more convenient settings.
Yeah, and I'll just add, Jonathan, this is Jean, that it does feed into this discussion over Medicaid and Medicare. This is a Medicare proposal that was on the table to move home, long-term services and support to Medicare in some limited format. And I think that could raise some interesting discussions here. The Medicaid debate will be happening, and there might be some plays of moving some costs to Medicare and then seeing what else states can be doing in a federalism discussion.
And Fatima, actually, I think there's a piece of this I might be wrong, that I feel like I've read or heard you about this before, which is such a big part of this is the caregivers and figuring out how, I mean, there's a payment standard of living for them, which connects to quality and also supply, where people are these caregivers. And I'm just curious, this is a huge issue. It touches things like immigration, but in a minute, do you feel like there's a chance to do this in a way that is good for the caregivers?
Well, there certainly is. I will say, in terms of its popularity, the relief that people felt when they saw a proposal that actually responded to their needs, the idea that they have to sort of nearly bankrupt themselves in order to care as they age. And most people want to age at home. And so we are, if not in this round of investment, we are running out of time to solve what is a coming crisis around how we care for those who are aging in this country. So maybe it's not this time, but people are focused and were energized by the possibility of a solution that spoke to their needs.
This is Jonathan, and I'm just going to underline that by saying I've been covering health policy for quite a long time now, and the news article I wrote about a proposal to help people pay for their home care drew a reaction from the public like nothing I have ever written. Just an outpouring of social media and letters from people saying, "Oh my gosh, this is my situation. This is my family. Please help." So I do think at some point this is a place where policy hopefully will go whenever it is. We are going to turn to audience questions. If you are in the audience, you can submit a question via the chat at any time. There's one queued up already, which I will read. This is from our YouTube chat. And I will, this sounds like a Gene question, but anybody who wants to weigh in on it can weigh in on it, which is, how will Medicaid look for patients in red states versus blue states?
So this is Jean. I'll begin by saying it already looks pretty different. We have really wide variation in how states run their Medicaid programs. The Texas Medicaid program looks very different already than the Maine Medicaid program. All that said, I'm going to be intrigued in watching a little bit of what Mark mentioned earlier. Do we see the incoming administration be more flexible with state requests on, innovation like housing and food, or do we see restrictions? I fear that there could be restrictions on whether or not waivers are approved that have anything to do with LGBTQ plus health or immigrants. There may be waivers that do go maybe one step beyond social determinants of health that could be pushed back on. There could be some, like in the state innovation waiver space, that are public plans like that Washington State and Colorado have that also could be scaled back. So I think it'll be interesting to see whether the federal government has a big imprint on what it looks like in a red state, but those differences exist now. We still have 10 states that have not expanded Medicaid, and that makes a world of difference in certain areas of this country.
This is Jonathan again. For our next question, I'm going to go to one that was submitted early. This is a deep policy cut. I think maybe Mark, you might want to take this one, although again, any of you could answer it, and I'd be interested to hear your response. The question is, will the new administration slow down the rapid pace of hospital consolidation and closures that are harming community access to hospital care while raising prices? Hospital consolidation is a big story. I think everybody who follows healthcare is aware of it. Maybe Mark, take a minute to just explain for people who don't know what that's about, why we would care about it, and then whether you think there'll be some action on it.
Well, it's Mark, and I'll draw on my economist roots here too. And one of the kind of general findings is in economics is when you have big consolidated organizations in a market with very little competition, price tends to be higher and quality can also be lower. And you apply that to hospital markets, something like over 80% of hospital markets in the United States are now in a category that economists would view as highly concentrated, meaning at significant risk for higher prices and limited alternative options. I do think this is going to be a high priority for the administration to address. The challenge has been, how do you get more competition into those markets? In the Trump 45 administration, there is a big emphasis on more transparency about pricing, making it easier for people to see what they'd pay if they went to one hospital versus another. I think people have viewed the way prices work in healthcare is sort of like when you go to the restaurant and, sort of every item would say market price instead of what you actually see, and nobody knows what that is, and it's harder to figure out than just asking your waiter. So there have been a lot of steps since then. This is another one where the Biden administration continued what the Trump administration started, where there's some bipartisan legislation pending to increase the penalties for not providing transparent and meaningful data to people that they can use. And there's been a lot of progress in organizations that help people sort out that information. So the new administration, I think, would like to see ways of empowering consumers more up ahead of time when they're making choices, not just about where to get an elective MRI, but where to get their primary care, where to get their care for a specialized condition like back pain or joint disorders or even cancer. More of a push there, and also more of a push towards policies that do not encourage consolidation. Right now, we have, as I was talking about earlier, higher payments for similar services that are provided in a hospital versus an ambulatory care clinic or in a community and in the home. And I'd expect to see, again, where there's bipartisan interest, I know the hospitals are concerned about this, shifts in that direction too, to try to pull back from a lot of the forces that have been contributing to consolidation in the hospital markets.
This is Jonathan again. I'm going to take one more question from the YouTube channel. The question is, what news outlets or sources would you recommend to stay up to date on public plans and state policies? I'll ask each of you to name one source just so we can get through it. But Fatima, you first. What's a source you would recommend people read or watch?
That's a tricky one. I'm glad they have asked that right now. This is not necessarily a news source, but I can't help but put a plug in for the report that the National Women's Law Center put together over the summer on Project 2025 and the gender justice implications. We tried to make it short, which means it's only about 20 or so pages, but it is very digestible.
Jean?
Of course, we follow you on HuffPost, so I will say that to all your viewers. But I will say, I heard somebody say that their approach to consuming news and looking for facts has become more like being a detective. Try multiple sources, go to the original sources, don't just go to social media. And I think it's less which one you go to, then go to multiple, but follow that track back to the original story to make sure that something is not being pulled out of context or is appropriately sourced.
Mark?
Yeah, I think it is. It's Mark, and I agree with Fatima and Jean that there's maybe not one source. And I'd say two things. One is there are some places that try to consolidate information, Kaiser Health News, Health Affairs. I put a plug in for the Duke Margolis Institute here too. We do regular events on Medicare, Medicaid, many of these other activities and papers and issues, and we have papers and other output on that. And I'd encourage you to maybe get out of your comfort zone a little bit. If you tend to follow the Democratic proposals, there's some places, I'd say the Paragon Institute tries to have some more Republican-oriented proposals that have a lot of justification behind them, the American Enterprise Institute. So we need to get through this next year. It'll help if people can diversify their sources a little bit and find some ways to move forward together on at least some of what are going to be some big and controversial issues ahead.
This is Jonathan again. That's great advice. Multiple sources. a wide spectrum. Try not to get outside your bubble, if only to challenge your own views. I have 2 minutes for closing remarks. I'm going to try to do a very fast lightning round here for each of you. I want one-word answers. Ready? Federal spending on healthcare will be higher or lower than expected at the end of the next presidential term. Mark.
Lower.
Jean.
I think lower too.
Fatima, if you want to answer. I know it's not your specialty.
Lower.
Number of people without health insurance, higher or lower than current levels at the end of this presidential term. Jean.
Uninsured, higher.
Mark.
Higher with an asterisk. I think you're going to see some other kinds of coverage that I know Gene is not going to like as much, but there will be some alternatives emerging.
A little bit of tension.
I know that wasn't one word. I'm sorry.
Fatima.
Higher.
And
Underinsured.
higher, more underinsured. And the single most important figure in the Trump administration on healthcare, who's it going to be? Fatima.
Jonathan Miller.
Jean.
I think it's going to be the Attorney General.
Mark.
I think this one's easy. Donald Trump.
There you
He's
go.
going to pay attention to these big issues.
There you go. On that closing note, this is Jonathan again. Thank all of you. That was a wonderful panel. I'm so glad we got to spend this time together. What a great discussion. And I encourage our audience to follow all of the panelists. And thank you for being part of this.